beauty means for me, it makes my day when somebody comes to me and tell me, doctor, I feel like my face is melting. I feel like I'm so anxious. I'm so sad. I don't want to take pictures anymore. It makes me feel great when I do like a lip filler or a Botox, or we do a little bit of facial balancing, and they cry afterwards. They say, "Oh my God."
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Cintia Ciriaco, a doctor of nursing practice originally from Brazil. She came to the United States at 18 years old and built her career from the ground up, driven by a deep passion to serve the immigrant community. She understands firsthand the barriers many immigrants face, especially those without health insurance, which is why she created a practice centered on transparent, affordable care. Her mission is to provide compassionate, judgment-free healthcare that empowers and uplifts the very community she once belonged to. So, Cintia, welcome and glad to have you here.
Thank you.
Yeah, so let's start at the very top. How did you first get interested in the medical field?
Well, that goes back years. I was 12 years old. I was living in Brazil, and my aunt had a big surgery, an abdominal surgery, and that it opened up. So at that time, they didn't have nurses to come to your house or anything. They would have your family members do all the dressings and take care of the wound. So the doctor instructed that she would have to have a dressing care, and it was wide open. It was like this open and this big, as far as I remember.
Mm-hmm.
He instructed to clean and put sugar in the incision. And we did, and was very successful. And daily by daily, the progress, the wound closed, and she was free of infection, and she did really well. So I got thrilled about that. I always wanted to be in the medicine or in the nursing field. So right there and right at that time, it clicked me. That's exactly what I wanted to be. I wanted to be a practitioner.
Okay. And so when you kind of went through that journey, what made you transition more to the aesthetic side of medicine specifically?
Well, we do both. We do family practice and aesthetics.
Okay.
Okay. So my background was like I was a registered nurse for about 10, 12 years, I believe. And my background was emergency care and ICU. So it was a very, very, it's live or die pretty much in ICU. So you're like in a position, like, you gotta react fast. So I loved what I did, but I, like every healthcare provider, get burned out, and I got a little bit of burned out. So then I was doing traveling nurse, which kind of like, it was a little better for me than being in one hospital, like all those shifts. Was about traveling nurse was more flexible. So I met my husband. I got married, and I was still doing nursing in ICU. And then we had kids, and he said to me, "Why don't you go to become a nurse practitioner?" I said, I don't know. I mean, they might not accept me. I mean, like, my grades are okay, but not like, all A's and all that. So I got in. The main person of the university called me in and said, due to your experience, we're gonna let you in. So they let me in. I study, and then my husband was a big supportive, because English is my second language. I came here when I was 18 years old, a very young girl, didn't know any English, didn't know anything, and had to learn. I had to study like for 3 to 4 years before I went to the college, then university, then the master, and then the doctorate. So it was I had a lot of challenges that I had to had to prioritize and take care of it.
Wow.
And so I don't know if you want to pause me and continue
No,
with the
that's okay.
question.
Yeah, no, that's good.
Okay,
Keep going. I
so
love your story.
I graduated in nurse practitioner in 2018. So I went to work with a medical doctor, I mean, an MD, and I was doing really well, doing family practice. So I saw him doing some aesthetics. So I said, I do want to do Botox and fillers and all that. I had no idea that I could do laser and I could do all that other thing. So I worked with them for pretty much like a year and a half. Then I went to a nonprofit organization. And when I went to this nonprofit organization, at that time, nurse practitioners in Florida could now work autonomously. The law changed in 2020. So from 2018 to 2020, I was working for this doctors and for this nonprofit organization. So I said, okay, I'll give you my services for free or for very low pay if you guys let me use your doctor as a medical director, because I needed a medical director. So she said, no problem. So I opened a little room for me with one of my preceptors. I was very friends with him. He was a very well-known OB/GYN in Boca Raton. And I opened my room there and I started seeing patients. So that time I started taking courses. I started seeing family medicine patients. And then at that time I started doing other courses in Botox and fillers. And then the patients just start coming, and I started injecting. I was like, people like my Botox. They said they last longer than anybody else that injected them. And I started doing more and more and more. So this was in Boca Raton. So one friend that had like a beauty spa here found out about me, and she said, would you be considering coming to Jacksonville once a month and taking care of my clients? They need Botox and I have no injector. I said, certainly. So I came to Jacksonville and I saw the need was not only aesthetics. It was we have a big population of Brazilians here. So they needed a clinic for family medicine. So I did 3 or 4 times with her. Then COVID hit. And but that didn't turn me down. And I had just started my doctorate in nursing at that time when the COVID hit. So at that time I did more than 4,000 to 5,000 consultations on COVID, and I developed a protocol for COVID. I had 2 patients that died on me with the protocol that I used. So it was very successful, and I treated a lot of patients. So then that time between March to October, I told my husband, we gotta move to Jacksonville. So he said, okay. I said, and I wasn't very afraid. I said, I'm gonna open the clinic and you work. If anything else, you support me, and then I'll start to develop the clinic. So he was totally for. He's a general contractor, so he can work anywhere. And we put our house in the market. We rented over here and we moved over here, and I opened the clinic.
Oh, wow.
So the clinic I opened in October 2020. I was seeing 1 or 2 patients a day because I had to know people.
Yeah.
And that's how I start building up the aesthetic side. I start with my family medicine patients. I start, hey, we do aesthetics too. We do Botox and lasers and microneedling. Oh, okay. Let me schedule, doctor. And it's when I start buying more products, having more clients, and then I bought a laser machine. So then I went into laser. So that's pretty much how it started. I mean, in conjunction with both things, and we still do both things.
Got
Okay.
it. Okay.
And I love the fact that I'm not in the hospital anymore. My husband said, you are unemployable at this time.
It's usually what happens when you start your own practice.
I said, yeah. I said, I don't think I can take much. I cannot see people telling me what to do much more. And we've been in practice for 5 years. And I love it. And I love it. I'm seeing more my practice before used to be about 90% family medicine. Now I'd say we're 50-50. We're getting to the point that we're 50% aesthetics and 50% medical, functional medicine and regular medicine.
Okay.
And we do more than that. We do IV therapy. We do lasers. We do CO2. We do skin lesions. We do all kinds of stuff.
Okay. So I know with your treatments, you do quite a bit of treatments. I want to dive a little bit deeper into hormone replacement therapy. So for people who don't understand, what is hormone replacement therapy and what can it really help with?
Well, hormone therapy is for men and women. Okay. Most men, after the age of 35, they start losing 1% of their testosterone a year.
Mm.
And men, as early as 30s, they start having premenopausal symptoms. Symptoms for women mostly are like, irritable, mood swings, can't sleep well, body aches, anxiety. So they come to fatigue and low libido. So they come to my office. I'm like sometimes a 30, 35-year-old with all the symptoms. And they don't have a clue what's going on with their body. They said, I don't know what's going on. I don't know if I'm anxious, but I'm having all the symptoms. What's going on? And it's a little bit different than the traditional medicine because most doctors, some of them are very reluctant to give hormones. Once we had a FDA warning, now we don't have it. In the past month, FDA cleared all that. So there's a lot of myth of oh, I'm afraid I get breast cancer. Oh, I'm afraid I have a reaction to the pellet. So there was a lot of reluctancy. Is that correct?
Yeah.
Against it. So I started developing the practice of the hormone therapy. And then I'll start seeing more patients like the same thing, irritable, a lot of visceral fat, not sleeping well, the wives are complaining, and joint pain and fatigue and going to work, eating well, but it's the fatigue is still there. So how we do our patients here? Every woman above 40, they need a mammogram, and then they all need blood work. I mean, there's a series of blood work that check their FSH, their LH, their progesterone, their estradiol, estrogen, their testosterone, and the men the same thing. Some of the men is a little bit different. Along with that, I do the thyroid, I do the other test that doesn't need to, but I like to do a complete profile. So we do that, and then with the symptoms, we generate a formula. So we know with the symptoms how much testosterone a woman needs, how much estrogen she needs, if she needs some, because usually we try to put if they're 55 and up, and the men, the same thing. Okay, they usually women last from 3 to 4 months, the men last up to 6 months. And they're totally bioidentical. They're done of plants, yams. And so that's what we call that bioidentical. And the why I'm so for pellets. I do give creams, I do give injections, but the pellets are better to your body because the way it's absorbed in the body, it's like continuously. Okay, you don't have that big drop versus like an injection or a pill. You have the peak and then you have the drop. So it's a lot of suffering, a lot of symptoms that the patient experience when he's taking a testosterone shot. It's like those ups and then it drops, up and drop. Versus the pellet, you're gonna have steady and then only gonna start drop probably like at the end of the cycle. It's like through the cardiac output to the the blood running on your veins and your arteries that start releasing the hormone, which we call pellets. Some people call a ship. It's not really a ship. It's like a little meds. It's a little cylinder meds that we put at the patient's gluteus or in the flank area.
Okay.
And we don't treat, the medicine needs to change. You can't treat a patient by the number. You have to treat a patient like if you see a vitamin level of 30, you can't just assume that the 30 is normal. According to the lab, is normal. But you can't just assume the patient's doing well with the vitamin of 30. You want it to go a little above that. You want him to be a little bit of 60. So it's that's the eye that you need to have when you analyze blood work. Same thing with the thyroid. You got to see their T4 levels. You can't just assume that it's if there's a normal range that the lab gives it to you, it's okay. And that's where functional medicine and integrative medicine comes into place.
Got it. Okay. Now, specifically for the women's side, my understanding is that you mostly want to do hormone replacement therapy if you're going through perimenopause or menopause. In
Correct.
your experience, have you found that really women should only come in to get checked up if they're having symptoms, or kind of regardless, it's just good to get checked up even if they're not necessarily experiencing symptoms right now?
It always good to get checked up early. I always tell them like annual exam tells her everything, not tells everything, but it gives us like a base. And sometimes they're not experiencing those symptoms, but when I sit them with them and I discuss the lab work, they say, "Oh, that's true. I have been experienced that, and I haven't even noticed." So it is good to have checked once a year.
Okay. And then from
Okay.
there, if your levels are low.
They don't have to put a hormone. They can choose to eat better. They can choose to exercise, diet and exercise.
Mhm.
The peptides are big things in the market now, and they have really good results. And hopefully the FDA approve more than them, so we can liberally we can prescribe more.
Mhm.
But there is other alternatives. The medicine nowadays, it's growing more into the natural side.
Mhm.
It's growing to the vitamins, the wellness, how you eating, how you treating inflammation. It's like I cannot treat a patient with, let's say, peptides if their body's all inflamed, if they're totally unhealthy. The body's not going to recognize what I'm trying to do. So you kind of have to prepare your body as well.
Okay, got it. Now, when it comes to this treatment, what would you say is some of the most common myths or misconceptions you've heard from your patients about? I know one you kind of mentioned was the FDA, the black box warning that they finally removed. So I'm sure you had a lot of patients coming and saying, "Oh, I don't want to do this because I don't want to get breast cancer or anything along those lines." But what are some of the most other common misconceptions you hear most often from your patients about
Most of them are afraid of needles.
this?
Okay, that's one. Most of them are afraid that they're putting something in and they have to wait it. There's no way to take it out, and they have to wait it that time until it goes away. And I explain to him, the symptoms are gonna be so mild that even if you have some symptoms, it's not gonna be enough to bother you. So it's what you experience is worse than if you experience a bad symptom. Breast cancer was a big issue. Prostate cancer was a big issue. That people still have the concept that if I'm putting hormones, I'm going to create a breast cancer. That's not true. Okay, there are studies that hormones now actually prevent women to have breast cancer. They enhance your health. It's like the fuel of your car. If you don't put oil on your car, it's gonna go bad. And it's and if you see a pattern, most people in their 40s, that's when they start developing high cholesterol, pre-diabetes, anxiety and depression. They start having they fall and their bones are weaker, and they're having insomnia. So what it's done, they come to the office, not me, I don't do that. And you put in a hypertension pill. Okay. Then a month, 2 months later, the patient comes in, "Doctor, my cholesterol is high." "Oh, you need another pill for your cholesterol." "Oh, doctor, I'm not sleeping at night." "Oh, just take some Zolpidem, just take something for you to sleep." "Oh, now I'm anxious and depressed because I'm taking all these meds." And I'm my life, it's like I'm really feeling that I'm getting old with this medicine counter. It's like this medicine cabinet full of medicines. So I tell my patients, I can prescribe you from medicine from A to Z. I know them all, but that's not my goal. My goal is to give you the less I can give you, to prescribe less as I can, and treat you and try to get your body and the nature that backstage again, the healthy stage again. Okay, so it's all about how you present it to the patient, how they trust you, how much knowledge you have about it, and the relationship that you develop with them. Okay, and if they trust you.
And when it comes to trust, this is a great follow-up to my next question is, let's say someone is looking for a doctor, a provider who can help them with this type of treatment, but let's say that they don't know anybody off the top of their head. What advice would you give to this person as they're doing their search so that they can find someone that they can trust, who does have the knowledge, has the experience, and can get them a good result in the end?
I think look at their licenses is one thing, especially in the cosmetic field, the aesthetic field. There's a lot of a lot of people doing illegal stuff. We just got a big case that the 3 clinics got closed here with the same owner because she was practicing medicine without a license. She was injecting everybody. So in the aesthetic field, please check who's injecting you. Please go. It's the Florida Board of Nursing, the Florida Board of Dermatology, or whatever state you are. Just check who's injecting you. Okay. Because in Florida and I think in Texas, there's a lot of iffy things going on. So and it's for more there, Botox and fillers can we think it's simple. It's not that simple. You gotta know the anatomy. Everybody's anatomy is different. Things can happen even with the best injector. You can have an occlusion. It can happen because our anatomy is not the same as everybody else. But choose a provider that is I do courses and I do mentorship all over the world. I go to Dubai, I go to Brazil, and I learn a lot from people outside the USA. And that has helped me so much with my injectable techniques, with even the way I do a pre-consultation. Okay, so check the person's license. Another thing that I would recommend it, look at their Google review. Okay, you're always gonna have 1 or 2 bad reviews or something that it's it's something can be on, sometimes can be honest, sometimes can be really dishonest. But check their reviews, and word of mouth. Word of mouth is the best thing. Okay. So that's my recommendations.
Yeah, great recommendations. Now, Cynthia, I'm sure that throughout your experience, you've had some memorable cases you've worked on, maybe even challenging cases you've worked on. Is there maybe one story that comes to mind that you can share of just one of those cases and how you were able to get them a successful outcome in the end?
Challenging cases, let me think.
Or even just a memorable one.
The most challenging cases are some people that come in and they're very low income and they can't pay for the services. Most of the time sometimes I do a pro bono and I help it. I had a case which was not in aesthetics wise, but I had a case that he's our gardener. He works in a garden. He came with his boss, and he'll suffer with this hand injury for a month. And he said, "Doctor, there's something inside. So I looked it up and it was pussing and everything. Imagine a month and you have how you call a sharp thing inside your splint. How you call it? Is it splint that we call in English?
Open wound?
No. Like when you get a piece of wood or something.
Splinter.
A splinter.
Yeah.
She said, I have something there. So I said, well, I can't visualize anything. I'm gonna give you a little bit of anesthesia in there. I'm gonna get my tools and I'm gonna try to see if I find any foreign object. So I made a little hole and I got in there and I pulled. Those little rosebuds, those little not rose, but it's very common in Florida. It's like a little plant, almost full of spikes inside. So I went in there and moved around and I got it out immediately. I got it out. So it was this big, and of course he felt released right away.
Yeah.
So that was one challenging case that we had. Another thing is people cut themselves in marbles and we got to stitch it. Sometimes we got to send them to ER. But we've had it all here. We've had all the things. And if I can't do it, I refer.
Okay.
But we really try to solve everything in our clinic because we know how the lack of resources they have financially and also of knowing somebody. And we try not to send them to the emergency room because that's going to be an arm and a leg. So we try to see if we can treat everything here.
Okay. And where do you think the future of medicine, particularly aesthetics, is going?
I think we're going more toward functional and wellness. I think the traditional medicine, it's gonna, of course, it's still gonna happen, but I think most people are looking for more natural stuff to get better. We're not only treating patients, we're treating symptoms. And and people are more into like, this concept of peptides, of hormone therapy, of IV therapy. I think we're going more that. And also the fact that we like, a lot of nurse practitioners are being able to work more autonomous. That has opened a big field for us. I mean, doctors sometimes are not happy with that because they still feel that we're a competition, which is really not. I mean, I'm have great doctors, friends of mine, and I'm not there to compete with him. I think there is like, open for everybody. There's business for everybody. But I think it's like with the lack of providers, I think we're feeling, the nurse practitioners are feeling more that gap.
Okay. Okay. And then kind of with that in mind, what is your vision for your practice, Health for All?
My vision, my practice is like I have a few students that I teach. It's to open other locations and to train people that have the same mentality as I do and continue opening. Open one in Orlando, maybe open one in down south, and 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 show my concept to the world. And it's if it's been working here, it can work in another space.
Yeah.
I mean, I just have to train somebody that will have the same mentality and the same goals that I do, so they run the practice the same way.
That's a great goal you have for the practice. A great vision you have.
Yes.
Okay, well, Cintia, I have one last question for you, but before I ask it, I do want to point people to your website at healthforall.net.
Yes.
Now,
Correct.
last question is, what does beauty mean to you?
Beauty means a well-being. Beauty means for me, it makes my day when somebody comes to me and tell me, doctor, I feel like my face is melting. I feel like I'm so anxious. I'm so sad. I don't want to take pictures anymore. It makes me feel great when I do like a lip filler or a Botox, or we do a little bit of facial balancing, and they cry afterwards. They say, "Oh my God!" Or sometimes they come with like the nose, and we do a little bit of nose filler, or sometimes we put a little bit of chin, and people hugs you and thank you for what you've done. That what makes me going. And I think that's what a beauty has to go. I don't think it's only the money part of it. It is a good like way to make money, let's say this way. But I think you got to treat more as an individual. You got to look more like at their happiness. What are you doing? Because sometimes people come here and they have like a lot of fillers in their face and their lips, and I preserve a lot of naturality. I keep it like that, and I refuse to do it. I said no, I think it's enough. I'm not more fillers on your lips. Okay, so, and some other doctors could just, okay, let's just put it in so we'll make the money. It's not about money. It's about making the client feel good and make the client come back to you for more treatments.
Very good way of putting it. Well, there you have it. Cintia sharing her expertise. So, Cintia, where can people contact you in your practice?
They can contact us via phone number 904-903-7961. We do have a direct line. We're very personalized care. We do DPC, direct primary care, but we also have our WhatsApp, the 305-546-80, that my nurse and my front desk pretty much triage them. And that's the way they can talk to me, because that phone, I always know what's going on. So if a patient says, oh, hey, listen, I'm taking such a medication, can she prescribe it? The girls will tell them that I can see them or not see it. So pretty much there's a triage. And then sometimes the patient gets to talk to me before they even see me. Okay, so some of the DPC ones, the direct primary care, they have my personal phone number, and they have more of a closer relationship with me. But even the other ones, they still get a hold of me. I talk a lot, which sometimes I should have leave to the back staff, but I don't, because that's my way. I'm very I care a lot for the people. Okay, and then we have the Instagram, which is Health for All Jacks. We have our Facebook, and we have our website.
Awesome. Okay. Well, Cintia, this is great. Thank you for coming on. Thank you for sharing your expertise, and thank you for sharing your message.
Thank you. Well, thank you for calling me and inviting me to the show. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.